distinguished guests, and dear colleagues. So in this 15 minutes time, I'm going to review the history of interventional radiology in Nepal. So this is the Trichandra Military Hospital. It was, and the first X-ray unit was installed in this hospital around 1934. And Dr. Madhusudan Lal Maske was the radiologist over there. Second unit was installed in the Bir Hospital, although this hospital was built in 1889. And again, Dr. Madhusudan Lal Maske was the head of the department over there, and he was later joined by Professor Tankabahadur Budathoki and Netrabahadur Amatya. And they started some sort of interventional radiological procedure in that institution, and they used to do direct puncture carotid angiography in the ordinary X-ray table and some venographic procedures. In 1982, the Tribhuvan University Teaching Hospital was established, and Professor Budathoki shifted to that hospital, and he was later joined by Dr. Raju Pradhan, Dr. Anand Shrestha, and Dr. Sunil Pradhan. And at that institution, there was a dedicated angiographic unit installed in 1986. And there were doing angiography, venography, nephrostomy, and different biopsy procedure, biliary procedure, and other diagnostic studies. Initially, the biliary procedure were conducted, performed by the surgeons in this institution, because this hospital was built with the help of the government of Japan, and there were some surgeons posted in that hospital. And majority of as in Japan, majority of procedure are done by the specialist in the particular field, not by the radiologist. So biliary procedure were done by the Japanese surgeons. And some of our Nepalese colleagues also used to do the biliary procedure. And this was the blind procedure with the PTC and all this, and it will usually take a long time. And later on, we started doing procedure under the ultrasound guidance, and gradually we take up all these biliary procedure in our hand. And in 1994, we had a symposium of the obstructive genius because it was a very common problem in that time, because most of the patient was referred to the teaching hospital, and a lot of other international speakers were also there. You see the Dr. Berry and Dr. Rao from Hyderabad and Dr. Nandi from All India Medical Institute. They were present at that symposium, and also the Japanese surgeons and the radiologists. And these were the learning opportunities and to learn the different methodology to tackle the problems. In 1990 to 2014, image-guided biopsy procedure was established in teaching hospital and in other institutions as well. Hepatobiliary intervention, bronchial artery embolization, renal interventions, vascular intervention, other mammographic intervention, sclerotherapy, pain management, and drainage procedure, and in head neck area embolization of angiophragmoma and meningiomas. Gradually, these services were available in other institutions as well. And as Dr. Baijal rightly pointed out, collaboration with the other specialties is very important. So here I am showing the picture of the Professor Siami. One is the pathologist and other is the cardiothoracic surgeon. So with the help of the pathologist, she was especially trained in cytopathology. So the diagnostic yield of our biopsy procedures went very high when she joined the Tribhuvan University Teaching Hospital. And Dr. Siami encouraged us to do a procedure under the fluoroscopic guidance, and sometimes we are even doing the identifying the cancer, even the small cancer. One of our colleague from the radiology department had a relative who had just a 1 centimeter diameter tumor, and we are able to biopsy that with the fluoroscopic guidance procedure with a positive result. And see, he underwent surgery in the Vellore, and they were very surprised to see that 1 centimeter diameter cancer was detected with the fluoroscopic guidance fine needle aspiration cytology. We started bronchial artery embolization in 1993 with the help of the Japanese visiting radiologist at the teaching hospital. And again, the Dr. Sayami was pivotal in this because we used to get a lot of cases of the hemoptysis, and there were no other options to treat those patients. So we started in 1993, and we presented multiple papers in the national and international forum regarding the bronchial artery embolization. So these are the photograph of some of my slides that we presented in 2000. And we also were doing a lot of biliary procedures, and we also published some of these results in the different journals, and we also presented this in international forums as well. We are doing hepatograms in the early 90s to identify the hepatic venous obstruction, because Dr. Santosh Manchest from Birastal was very keen, and he has done a lot of research in the hepatic venous obstruction, and he requested us to do a hepatic venography to identify. And some of in these cases, we also do hepatic venoplasty from the transhepatic route. We did a lot of vascular angiographic study, and we also published in various journals and different vascular embolization procedures, renal interventions, and these are also documented in the different journals and publications. And we also did a lot of angiographic procedures in the head and neck areas, and one of the common problem were the bleeding from juvenile angiofibroma cases, and we used to do angiographic procedure before the surgery, and we have published this in various journals. So mammography guided biopsy procedures, especially when the mass was not palpable and not seen in the ultrasound, we used to do wire localization, and surgeons used to take the lump from that other lesion with the guidance of these wires. The difficulty were the lack of gadgets or the interventional. So Dr. Charles Guzung was very generous. He founded the Radiology Outreach Foundation, and every few months he used to parcel us the angiographic catheters. So we are fortunate enough to have Cook's very good catheters and gadgets so that we could perform our radiological procedures. And in 2014, it was a very good moment for us because we could establish an interventional radiology unit in the Tirvan University Teaching Hospital with dedicated angiographic unit, DSA unit, with the ultrasound machines for the biopsy procedures. And right now, Dr. Ajit and other colleagues are working in that institution. In 2010, we established the Nepalese Society of Vascular and Interventional Radiology, and my interventional colleague, Dr. Bhanasam Girung, was pivotal because he pushed me always that we should have a society for interventional radiology in Nepal. So we registered that, and these were the members of this first committee. And in 2015 began the new era of the development of interventional radiology in Nepal. So these services was now established in other, not only in the Kathmandu, but other places outside the Kathmandu as well. And we got the first trained interventional radiologists. Amrit Koirala joined us in 2014. And again, the other neurointerventional colleagues also joined around 2018. Now we could do a complex interventional procedure in the country itself. And we did a lot of educational and activities as well, and international collaboration to further develop the intervention radiology in Nepal. In 2016, we organized an international conference in the interventional radiology, and we, in the same occasion, we honored our pioneer in the intervention radiology. And that conference was attended by Professor Michael Dake and Lin Chun Lee from China, and other speakers from the US, Netherlands, UK, and India. And it was attended by, at that time we were only 10 or 15 interventional radiologists, but it was attended by the physicians from other different specialties. We conducted many workshops during this period, not only in Kathmandu, but in the other places outside of Kathmandu as well. And it was, these workshops were attended by enthusiastic, our radiology colleagues. We had a guest speaker from Korea, and we organized different radiological symposium. In COVID time as well, we did organize the workshop and symposium as well. In 2023, we organized second international radiology conference, and there was attendance from various international faculties, and it was well attended. We also conducted biliary intervention symposium in 2023, annual conference with in collaboration with our Korean colleagues in 2024. And we also performed live workshop at that time, and complex biliary, hepatobiliary procedures are performed, including part 2 from the surgeons, from the radiologists. We did the first part of procedure in the world, first time. Supportive environment and training is very essential for the development of any specialty. So we owe to Professor Sanjeev Sharma, the professor of radiology in the All India Medical Institute. He supported us to organize different workshops, and he also supported us in training our radiologists for a short period of time in various institutions in India. Post-graduation radiology education was started in 1988, and in 2024, we were able to establish an accredited intervention radiology fellowship program in Nepal itself, and our first graduate is now working in the Pathan Academy of Health Sciences. This was a neonate who was admitted in our hospital with a cardiac failure. And during the scan, we found a large vein of Galen aneurysm. And Dr. Subhash Phuel was at the end of his training in the All India Medical Institute in the neurointervention at that time. And I called him, and he came from India to perform this procedure in 2018. And they successfully embolized this vein of Galen aneurysm. So that way, the neurointerventional procedure in the Nepal started with the difficult and complex cases. Now the neurointerventional procedure are done in various institutions in Kathmandu and also in few of the places outside the Kathmandu. So now we have around 31 interventional radiologists, fellowship-trained interventional radiologists in Nepal, and they are working not only Kathmandu, but in various places outside the Kathmandu as well. And a lot of people are getting their services outside Kathmandu as well. The challenges in the IR is the human resource deficit, lack of training infrastructure, absence of career pathways, infrastructure and equipment limitations, financial and insurance barriers, and awareness gap among the clinicians and also among the public. So the difficulty is that sometimes we are not able to continuously renew our interventional gadgets or the equipments. And for example, in my own institution, the Tirvan University's hospital, after the first mission was broken down, we used to carry out all the angiographic procedure, interventional procedure in GI fluoroscopic table for many years. And only in 2014, we were able to get a DSA machine and dedicated interventional unit in that hospital. And also the accessories were sometimes depleted, and you have to do what? You have to do improvisation. Otherwise, you will fall down. So, and at that time also we used to use the other, whatever the material that was available with us. For example, for PDPD, we used to use feeding tubes and sometimes the endotracheal suction catheters. In early 90s, we used to refashion these tubes for the catheter for various procedures, angiographic and also the drainage procedures. So to conclude, the history of interventional radiology in Nepal is relatively recent. However, the field has made significant progress over a short period. Despite this achievement, several challenges continue to hinder its development. To address these challenges, there is an urgent need for advocacy to establish formal IR positions, develop structured career pathway, and invest in specialized infrastructure within the medical institution. Strengthening policy support, improving insurance coverage, and expanding training opportunities will be essential for the sustainable growth of the interventional radiology in Nepal. Thank you.